what what is the arthritis means? It is the same which happens in all the other joints. So we'll be looking into the definition, incidence, reason for the low incidence of the primary arthritis in the ankle, diagnosis, conservative management, and summary. So by definition, it is degeneration involving the tibio-talar joint. It can be globally, where it involves the whole joint, or it can be focal, which involves the one area of the joint. It can be mainly because of the trauma. Incidence, it's 9 times less common than the hip or knee joint, still affects the millions. True incidence studies in India is still not known very well. The reason of the lower incidence of primary osteoarthritis of the ankle, it is because of the congruent joint with the high load index, and it's a highly constrained joint. Uniform cartilage thickness of 1 to 1.7 millimeters. Ankle cartilage resists deterioration under normal physiological condition, that is old age. Etiology is trauma, primary, which is very less. Secondary can be because of rheumatoid, hemochromatosis, hemophilia, clubfoot, AVN, and OCD. These are the few X-rays of the arthritis. Diagnosis mainly because of the accurate history, physical examination, look for the swelling, tenderness of the joint line, range of motion which will be very much reduced, and painful walk, and extra-articular manifestations such as nodes. Diagnosis such as imaging, that is the X-ray, which is very, very common. Next comes the ultrasound, if there is a soft tissue manifestation. CT and MRI, the role of aspiration is still debated. Management, the goals of management will be restoration of the mobility, pain-free joint, and improve the quality of the life. So the conservative management, first you should aim at the weight reduction and lifestyle modification, painkillers, that's pain relievers which can be given, intra-articular injections either in the form of PRP or steroids, DMRDs when indicated, footwear modification, that is rocker bottom sole, satch, and orthotics, such as double upright brace, AFO, and Arizona brace. These are the few footwears what we use. Intra-articular injection, first is the corticosteroids. This gives immediate pain relief, but it won't change any pathology over there. But most of the people would like to have just a pain relief. So some patients we can give corticosteroids. Hyaluronic acid, there is a mixed reaction. Platelet-rich plasma, the initial phase of arthritis, definitely it helps the people, such as grade 1 and grade 2, where the people will feel the relief. Mesenchymal stem cells, I do not have much experience on this. Coming to the summary, commonly encountered problem, incidence much lower than the hip and knee joint. Secondary arthritis is common than the primary. Conservative management is successful in indicated patients. Surgical treatment needed eventually in patients with progression of the arthritis. So few are the surgeries, what surgeries we do for the arthritis of the ankle. See, this is one patient who had come with the medial malleolar fracture and the talar dislocation also, for which it was stabilized with external fixator, and medial malleolar was also stabilized with the KY. Later, subsequently, the patient developed arthritis, and also you can see the subtalar arthritis which had happened over there. And the patient only needed the TTC fusion, that is tibio-talar calcaneal fusion, and the patient is doing quite good now. Case 2, this is a neglected fracture talus, subsequently developed arthritis of the ankle over here, and also developed the subtalar arthritis. And these are the few pictures where how we do the TTC fusion, and finally the patient is doing well with this.